Hey everybody, Luke Gordon here, and I recently got a really good question about total knee replacement rehab from a gal that was asking about if you get stiff knee syndrome, how do you treat it once you've got it? So I made a video a while back that talks all about how to avoid stiff knee syndrome, which essentially is when you're doing your total knee rehab and your knee is just stiffening up on you. Your rehab isn't going quite as planned. Your range of motion, so like your ability to bend and straighten your knee, just is kind of stalling out. And so I had a whole video about how to avoid that, and it was all about the early things you can do. But again, this gal's question was more along the lines of, well, what if I'm already a month or two after knee replacement surgery? Now what do I do to treat it? And I had kind of a similar video on it, but since that time, I've got a lot more ideas to throw at you. So I'm just going to kind of show you or explain all of my ideas. So if you're already in that rehab phase after your total knee surgery and it's really getting stiff and you're not quite sure what to do with it, I've got a whole bunch of things that you can do to try to treat the stiff knee. So what I'm going to do, the overall message of the video really is to take all of these ideas, as many of them as you can, and kind of like just throw the kitchen sink at this thing. Because if you're in this position where now your knee is kind of plateauing, you're getting to the point now where the time is kind of working against you. So the longer it takes you to get your full range of motion back in your knee, the less likely you are to get it. And then you're getting closer and closer to manipulation too, which I'll talk to you about that a little bit later in the video. So again, when you have these situations in life, I think the best thing you can do is take any good idea that you can get, and whether it's a couple ideas here, a couple ideas there, I'm going to give you about 6 of them in this video, and just try to implement as many as you can all at the same time, versus like saying, well, let me try this idea first and that idea second, maybe that idea third, and see which one works. They're going to work better synergistically. They're all going to work better together. So again, take the ideas from this video and apply as many of them as you can, and hopefully that'll help you kind of get out of this trap of having a stiff knee. So that's the overall message first before I get into all the topics. So the first thing though, if you're not already doing it, the first thing you want to do if you're kind of developing this stiff knee is you want to get aggressive with your stretching. So if you've kind of been on the fence, or you have like a low pain tolerance or whatever it is, and you haven't been aggressive with your stretching, now is the time to get aggressive. And that means pushing a little bit harder on your stretches, and it also means holding longer if you can, or doing some of the more uncomfortable stretches. Like if you're having a hard time straightening your knee, one of the most uncomfortable ones you can do is laying on your stomach and letting your knee hang off the edge of like your bed. So some of those ones that maybe your PT has been telling you to do, but you just haven't wanted to do because they hurt, might be time to do that. Speaking of which, a little side note, hopefully you're working with a PT. If you're not, it'd be a good idea. And if you are working with a PT, make sure that they understand your concerns, that they're pushing you hard enough. There's a huge variety of PTs in terms of how aggressive each one is and how comfortable they are getting aggressive. So make sure you find someone that, if you need to be pushed, that will push you. And if you know you have that personality type where you kind of take it easy and you need someone to push you, find that therapist immediately. Okay, so that's the first thing, aggressive stretching. The second thing that goes hand in hand with that with a PT is you need some aggressive, skilled manual therapy as well. So as a patient recovering from total knee surgery, there's so much you can do to yourself. You can do the stretches, you can do the exercises, but at the end of the day, as a therapist, there are things that we can do that you can't do. We can do more aggressive types of massage, like instrument-assisted massage, scraping type massages. We can do cupping. We can do different types of joint mobilization techniques that are more aggressive, that really you can't do on your own. And then you've also got all sorts of really good taping techniques as well, between kinesio tape and McConnell tape. So there's a lot of skilled therapy that you can't do on your own. The trick again is, if you're working with a PT, to make sure you have one who can do those things, because again, it's a bell-shaped curve. It's a big continuum of skill sets, and some PTs aren't even really willing to put in the extra effort to do these things. So again, make sure you've got the right PT who can do some skilled manual therapy with you too, because that's really going to help. You can't really mobilize your own joint that well, but we can. So working together in conjunction with you doing the aggressive stretches on your own and us doing the aggressive manual therapy, hands-on therapy, it's really going to help together. The other thing that I think, so that's the second thing. The third thing then is to reduce your swelling as much as you can. If you've got a stiff knee, depending on how far out you are in your recovery, 2 to 6 months, you're almost guaranteed to still have a fair amount of swelling. Beyond 6 months, maybe it's not swollen, it's just stiff. But if you have swelling, the more you can get out, the better. So in some previous videos, I've talked about reducing swelling, some simple ways to do that, which I'll link here, and I'll link at the end of the video too. But you want to do as many of those things as you can. So things like compression, aquatic therapy if you can do it for swelling swelling reduction, working with a lymphedema therapist if you have one that can really work the swelling. It doesn't have to be a lymphedema therapist. You could just get a therapist who's really good with their hands and who's willing to lay you on your back with your leg elevated on a wedge so it's above your heart and just pull that swelling down the entire leg up towards your groin and your abdomen. But again, you've got to have a therapist or a caregiver or somebody who's willing to do that kind of work. And sad to say, not to pick on all the PTs in my realm, but a lot of PTs aren't willing to do that. So you got to kind of be your own advocate here. Show them the video and they can leave me a nasty comment or something like that. But actually, it's not a bad idea. Show them this video and see if they agree, and have them do some of the things we talked about. So anyhow, that was the third thing. Reduce the swelling as much as you can, because that makes a stiff knee so much easier to stretch and mobilize, brings the pain level way down too. Aquatic therapy is the fourth thing. So aquatic therapy does help with the swelling and the compression because of the gradient, the pressure gradient in the water, but it also helps because it's a much more comfortable environment to stretch in and exercise. So just getting that movement, aquatic therapy can be huge for you. So whether you do that on your own or with a therapist, again, better at least to do some with a therapist so they can show you what to do. And then if you're a little more independent, you want to do it at the YMCA or whatever fitness center you have in your area, that helps a lot too. The fifth thing that I don't think I've ever mentioned is that I am a big believer in cold water therapy. I'm kind of a Wim Hof guy, if you've ever heard of Wim Hof, and that's like freezing cold water submersion. When I hurt my knee back in December, one of the best things I could do for it was just to freeze my entire leg and my body. I do that with cold showers primarily. Where I live, the water is freezing cold in the winter. I live in northern Idaho. But, you know, now you got to get a little more creative in the summer and stuff. But depending on where you are, I did really well with cold submersion. You got to be careful, of course, with cold water submersion. You've got like heart issues, other major medical issues. You can always ask your doctor. But in general, I found that actually not just icing my knee, because icing your knee is great for swelling and pain too, so you could do that. But to actually freeze like your entire section of your body, actually to me really took the pain and the inflammation out of that joint. So consider that. And there's different ways to do it. Again, you can look up different ways to do cold submersion, cold therapy, things like that. But I think, you know, even just a freezing cold shower, if you're up for it, again, check with your heart doctor, all those good things if you have medical conditions. But I think cold immersion is really valuable. Okay, so that was the fifth thing. The sixth thing, and I've got 7 things, I guess, so bear with me here. But again, this is the kitchen sink. Throw it all out there, do everything all at once, and hopefully this will help you break through whatever barrier you're running up against. So the sixth thing was, if you aren't taking your pain medications, if you're earlier in the phase of recovery, I always tell people you want to take your pain medications as prescribed. Don't let the pain get in front of you. So that can be a big one earlier on, especially. Again, if you're 4 to 6 months out, you should be off the pain medications by now in general. But again, talk to your doctor, talk to your pharmacist about your pain medications. But if you cut them off too early, potentially that can be slowing you down. Go back to the beginning of this video. How easy is it for you to do aggressive stretching if you're in severe pain? Not that easy. So I think it's worth taking the pain medications for that period. The risk of you getting stuck on pain medications or addicted is super small. So make sure you're doing that. The other thing I'd mention with that too is if you can do some natural anti-inflammatories like a curcumin, a boswellia, gosh, I should have written down the other ones. There's a lot of natural anti-inflammatories that I like. I'm a big curcumin fan, like a curcumin phytosome. I really like the thorn one. But talk to your doctor about those too, because if you can add an anti-inflammatory, especially a natural one that isn't going to mess with some of your other body systems like your kidneys, that can be helpful too. Again, medical conditions, you always want to talk to your doctor or pharmacist to make sure you don't have any other drug interactions. So just put that little warning there too. Okay, lastly, the last thing I want to mention is that there are times when you're going to need a manipulation under anesthesia. I made a whole video about that, which I'll link at the end here too. It's called an MUA for short, manipulation under anesthesia. And my advice is that if you're getting to the point where you think you need a manipulation, get one sooner rather than later. That's just my advice. You got to talk to your surgeon, obviously, because they make the decision on that and they make the call. But if you're not happy with your progress and the knee is super stiff, you might need that. So again, throw the kitchen sink at it, like with this video. Do everything in your power that you can. But at the end of the day, if it's just still stiffening up because you're one of those lucky people that lays down scar tissue really quick and really thick, get into that sooner rather than later. I've actually had clients who needed 2 of them. And it was nothing they did wrong. They just needed 2 manipulations. And we got in there and did aggressive PT following it. And it worked. So those are the things. So that's a lot of stuff. Again, I'll go through it again. Aggressive stretching, aggressive skilled manual therapy, which could include taping techniques, reduce the swelling with types of compression and swelling reduction massage, Aquatic therapy, if available. Cold water, just a little bit different. That's number 5. Take the pain meds, the anti-inflammatories was number 6. Again, with a doctor, pharmacist's permission. And then lastly, 7th was manipulation earlier rather than later if you need one. Okay, that was a lot. I'm gonna link a couple of videos at the end here. I got a video on how to decide if you need the manipulation and a video for simple ways to reduce swelling that I think will help you out. I would love to hear your feedback. If you thought the video was good, that's great. Give me some feedback. Share your stories on your total knee surgery. Share your stories if you've had to go this aggressive route and how it went. Did it work? Because a lot of people are looking for motivation and inspiration. So your story could help somebody else. So share that in the comments below. Leave me some pleasant thoughts or comments too. I'd appreciate that. And thank you for watching.